The humanitarian crisis in Gaza continues to worsen, with reports of Israeli forces opening fire on Palestinians waiting for food aid, leaving dozens dead and hundreds injured. Doctors Without Borders, MSF, teams are on the ground treating severe injuries amid collapsing healthcare infrastructure, so desperate that medical staff are donating their own blood to save patients. Joining us now via Zoom is Dr. Amy Lowe, medical team leader for Doctors Without Borders in Gaza. Dr. Lowe, appreciate your time. Thank you so much for speaking to us. Can you describe the scenes at Nasser Hospital when these wounded patients arrived? What were the most urgent needs from what we understand?
Well, when these events happen, they're called mass casualty events, there's a huge influx of injured that come to the hospital. Already Nasser Hospital is one of the main hospitals, only functioning one in the southern part of Gaza. So these patients come in one after another with severe injuries, shrapnel burns, bullets, and it increases the load on the hospital that is already overflowing with many patients for the other things that, a regular hospital would treat, children, heart attack, regular things. So it is quite a catastrophic situation right now. We have a pediatrics department that was overflowing, and we did create a tent space to accept more pediatric cases. And that space has been taken over by the number of war wounded that have come in from these mass casualty events at the distribution centers.
Now, some patients, from what I understand, say they were shot by drones, tanks and soldiers while waiting for food. What does this reveal about aid access in Gaza? And is this indeed the correct information?
Blockade since the 2nd of March. No food or medical supplies have come in. So the people are quite desperate for food. They're hungry. And they would go to great lengths, to feed their children, to feed themselves. So people get in line at these designated sites, which is not done by a humanitarian organization. It seems more of a forced displacement that's happening, that's luring these people to these distribution sites. There are very few sites open right now. There's about 4 sites open, and the population that has not received any medical aid or food aid since the 2nd of March is over 2 million people. So you can imagine if there's only 4 sites that are open, for 2 million people, I mean, the rough calculation is 500,000 people at each site. That's not in the way that aid is being distributed on the ground is with all these being matchups and all this.
So talk to me a little bit about MSF and how you're coping. I mean, how big are the teams that you have on the ground amidst these influx of casualties that you're having to manage?
I mean, we're managing, my team personally is 2 primary healthcare centers. One of them is quite close to one of the distribution sites, and it's a primary healthcare center. So there's vaccination, pediatrics, antenatal care, postnatal care, all the things that you need on a regular basis. But last week, we've seen an influx of mass casualty incidents even at our primary healthcare centers. The closest hospital is the Red Cross Hospital, the ICRC Field Hospital, and they're overwhelmed. And so some of the walking wounded have been able to make it to our site, but also in a mass casualty event. So there's quite a number that come in a short amount of time. We stabilize them and then have to refer them to Nasser Hospital. So we have a emergency team of 1 nurse and 2 nurses and 1 doctor that work 24 hours. And then during the regular working hours, there's the rest of the team, the pediatrician, the gynecologist, the vaccinators, the malnutrition clinic that's being run as well. But we do see that there is a huge need for healthcare professionals. ICRC did ask us if we were able to supply them with a few nurses to cover some of the mass casualty events that were occurring. Because we know that most mass casualty events recently happen when the distribution site is open, we have been able to kind of preemptively give them a few nurses, lend them a few nurses to help them out on the days we know that mass casualty events are expected when these distribution sites are open.
Now, one critical area, from what we understand, is that of blood supply for transfusions. And we understand that you or some of your staff have been giving their own blood to augment the lack of supply.
Nasser Hospital, it is the main hospital in the southern region, and they have the blood bank. So the days I've been at Nasser Hospital, I've seen that there's been a big call for blood almost every hour on the loudspeaker, asking people to donate blood because of the massive number of injured patients that come in. All these orthopedic and trauma surgeries need blood. So they've been calling on the population to go. Staff at the hospital are, they're allowed to go if they want to go, but I guess as a healthcare professional, you always want to help when you can. So our Ministry of Health colleagues, national staff, it's their own choice to go, and I think they just feel the calling to help out where they can.
Now, I'd like to touch a little bit on how you're coping and your teams are coping emotionally, right? Because you've obviously given your lives to assisting people, but I'm not sure you were well prepared, certainly for some of the catastrophes that we're hearing about.
Borders for over 10 years, and this is definitely one of the most difficult assignments I've been on. But I would say that I'm here for a short amount of time. For me, what is more difficult to watch is how the local population is coping with this. It's been over 19 months that they've been surviving this escalation. Every day they hear bombardments. Every day they're under constant stress and fear. There's no security. There's nothing stable in their lives. They can be called at any moment to be displaced or evacuated from where they live. When they go home, they don't know if their family's still going to be there. Every night they hear the bombardments. They don't know if it's their tent or their neighbors or their family in another area. So they're always under constant stress. And then they come to work every day and forget a little bit about the stress they live at home. But then, for a moment, it seems normal. They're working at a hospital, the professional nurses and doctors. But then some of the cases that they see are quite horrific, and in no medical school will prepare you for these things. Mass casualty events that happen on a daily basis. This doesn't really happen anywhere else in the world but here. And these doctors and nurses have to be exposed to it every single day. The stress on them is immense. I know that they're exhausted. And all they want is for this to end, for a ceasefire and for the blockade to end, and for them just to go back to a normal life.
And how are you and your colleagues coping? And also just, when you think about this and the amount of pressure, you must be wary of your own safety, because from what we see, sometimes it's even hospitals themselves are bombed.
It is quite a dangerous situation. Like of all the assignments I've been on, this is probably the most shelling I've heard. But again, I'm only here for a limited amount of time. Our security rules, we have curfews, mechanisms to protect ourselves. It's more the local staff that I find are struggling a lot, because they're living here every single day. They don't have the same protections that we have, and they have to go out to the market and do their daily lives. They're more exposed than we are. So for us, we're here for 6 to 8 weeks, and then we go home to our regular world.
Dr. Amy Lowe, Doctors Without Borders medical team leader, thank you so much for taking time to speak to us and walking us through certainly some of those challenges that you're facing and the great work that you and your colleagues are doing out in Gaza.